Hello and thanks for joining us on Health Options, the program that not only tracks government's policies on health, but helps you with the information you need to make the right choices about your health. Welcome to the program. I am Rabi Abdullah. The scientific and medical community is getting excited that immunity against COVID-19 isn't such a tall dream anymore, thanks to the breakthrough on COVID-19 vaccine. In this part of the world and countries that the COVID-19 vaccine is beyond their reach at the moment, the very important advice experts keep sounding is for people not to let down their guard, but must continue practicing non-pharmaceutical interventions to prevent contracting the disease or transmission to others, as well as taking supplements to build the immune system. Why is that necessary? The answer is simple. So that not only will the immune system act as a defense against the coronavirus, but help prevent those that have the disease from progressing to a severe phase requiring intensive care and eventual death. On this episode of Health Options, we bring to you immunomodulation therapy and COVID-19 vaccine from a very interesting perspective. The emergence of COVID-19 is one that has brought out the ingenuity of Nigerian scientists and researchers. Join us on Our Nature Scanner for a peep into some local solutions to COVID-19 that will in no time become available and accessible to Nigerians, given the required political will and funding. This is Health Options, and we are taking a look at immunomodulation amidst the second wave of COVID-19. And with me in the studio to take us through the topic is an integrative medicine expert, Dr. John Tor Abide. It's good to have you join us on Health Options, Dr. John Tor Abide.
Always my pleasure, Rabi.
Okay.
Always my pleasure.
All right. It's a confirmed status that Nigeria is in the second wave of COVID-19. Why are we experiencing the second wave?
Second wave can come about as a result of many factors. But key among those factors is that of, viruses actually exist in what you call, strain. You have a particular strain, and then that strain can mutate to a different strain. Let me just take you not too far. This is why, if you look at, influenza or the cold, virus or the cold flu, you see what they call the antigenic variation, that virus keeps changing, makes it very difficult for us to actually have vaccines. In case of COVID-19, which is SARS-CoV-2, it is an RNA virus. It is very huge. So that mutation, the rate at which the mutation occurs is very, very slow. When you look at a mutation, the first mutation can go in different directions. A mutation can occur so that the resulting strain is more virulent. That is to mean that the rate of infection or the rate at which it induces mortality or that is killing people is really high.
It's been said that people let down their guards, social gatherings became the order of the day again, and a whole lot of things have been taken for granted. Are you telling me that if people had done the needful and adhered to the non-pharmaceutical protocol for COVID-19 safety, would we still have been experiencing the second wave?
The answer to that is actually no. However, there are certain aspects of mutation that can come about. If the mutation, as I said, comes and then you have a more virulent, virus you would have. But you can reduce this if you are adhering to non-pharmaceutical interventions. That is to mean that the degree of transmissibility will be reduced if we adhere strictly to non-pharmaceutical interventions. Here again, it's very unfortunate. We came to the stage of, community, transmission. And we never, I think we laid down our own guards, just like you mentioned earlier in in the introduction. However, another caveat of it that we should know, that I would like to explain to the public, is that in case of those people who have, underlying, conditions or comorbidities like cancers, diabetes, and this, you see that they have a weakened immune system. So that when the virus goes into them, it is able to mutate to a different and a more virulent, strain of, the virus than the others. But the bottom line is that if we adhere strictly to the non-pharmaceutical interventions, we would have the degree, we will be able to control the degree of transmissibility. So that we don't have a new mutant or variants or strains of the virus, because this is it. If you actually have, and if you want to know, if the virus mutates into the form that is more lethal, it is even better, because it is able to kill those people quickly, and it will not be able to transmit further if we adhere to the non-pharmaceutical interventions.
Okay,
yes.
So like I said in my opening, that the scientific world is really excited about the breakthrough that saw the development of a COVID-19, series of COVID-19 vaccines. We have the Pfizer, the BioNTech COVID vaccine, but of course we know what the situation is. It's about self-preservation. Countries are taking care of their own people first, talking about the developed countries who have recorded this breakthrough. And if you look at where we fall into, developing countries such as ours, as people are still being constantly reminded to adhere to the non-pharmaceutical intervention, to at least limit the transmission of the virus, so that our infection rate can't really be significantly brought down. We are here in the middle of COVID-19 vaccine, but for us, it's still beyond our reach for now. What is the best thing to do now? Because we're talking about immunomodulation here. What is the link between immunomodulation and vaccine? Assuming the vaccine is it about, you take it and you are assured of that immunity? Is that all about it?
No, it is not all about it. Let's do some little bit of education here. The best way, there are various ways which you can attain immunity or protect yourself against the disease. We know that you can either inject the virus directly into people that develop immunity. You can also develop keep adherence to the non-pharmaceutical interventions, and those include the total lockdowns. Then you have vaccination. These are all geared towards taking you to attaining a herd immunity. That is the bottom line. Let's look at what vaccine does and immunomodulation. Vaccines, all it does is to stimulate your immune system so that the body is ready. Let's look at what is immunity. Immunity, you have what you call the innate arms of immunity. Immunity has two arms. You have the innate arms of the immunity, and then you have the adaptive arm of the immunity. The innate arms of the immunity is what sets in first when there is a challenge in the body with those particular white blood cells. You have the macrophages, they have the neutrophils, then you have the dendritocytes, and then all of them, different type of cells, they come in and then clear the virus. Within the first 3 to 4 days, if they cannot clear, then that is why you move into the adaptive arm of the immunity. That is when you're talking about antibodies that are produced against the virus. So once you get that, then you handle it. But let's use this word very carefully: immunomodulation and immune boosting. What you want to have is immunomodulation, so that means that the immune is actually controlled. There is a saying, and mark this: nutrition is the firing power of immunity. Even when you are talking about vaccines, if you give vaccine to an individual that is nutritionally compromised, the depth or the extent of immune response will not be good, because the immune is a very complex thing. It needs all nutrition. You have what we call the micronutrients, things like zinc, things like vitamin D, things like a lot of them, vitamin D, vitamin C. They are all needed and make up, the immune system. So nutrition is very important, is very key, and that's why we say that nutrition drives our immune system.
Okay, so while we await the arrival of the COVID-19 vaccine, hopefully it shouldn't be in too far distance. What would you advise Nigerians to, indulge in? That's talking about immunomodulation now and boosting of immunity through nutrition. What should we be doing?
I'm glad you say why we await, the vaccine. We don't know when. We don't know when. Although we've been told that it's going to be here next year, pray so that it will be. But while we await the vaccine, we should equip our body's natural defense system against it. Just like you said earlier in your introduction. If your immune system, if you're well immunomodulated, that is, your immune system is up and going, even when the virus comes, two things will happen. Either, the body will defend against it from getting into your body, or worst case scenario, even when the virus gets into the body, then the immune system gets up and fights it. You will no longer go into that, the progressive phases of the disease that ultimately lead to intensive care units.
Let's just get your clear recommendation on what Nigerians should be taking at this point in time.
Well, I'm really happy with that question. As you mentioned, we actually operate a center of integrative medicine here. We've come up with what we call immune modulating or immune boosting, if you want to hear the old word, boosting protocol. These are various micronutrients that we give. And mostly some of these, because of the challenge that we have here, you need high doses. It's no longer a question of, yes, I can get vitamin D through the sun. I can get vitamin C through, citrus fruits like, oranges. No, the body is overwhelmed. You need those high doses so that it can take you up. Top of the list on the protocol or immune boosting protocol that we have, vitamin D is key. Vitamin D today plays a role in immune system than we had ever known before. Is key in our immunomodulation, activities in the body. You have vitamin C.
So in what form is it given?
Vitamin D, as I said, in this form, you have to give it in the injectable form, and it has to be in high doses. And this is why the knowledge comes through, because some people will hear that you give high doses of vitamin C. They will say, oh, why do you have to give those high doses? But this has been internationally, recognized and recommended by experts who are using it. Then you talk about vitamin C, it is also injectable. Then you talk about glutathione, which is also very important. Glutathione is a tripeptide. It contains 3 sulfur amino containing, amino acids. It plays key role in the body, immunoregulation, that is the immune system. It is anti-inflammatory.
Okay, on a final note now, what seems to be playing out here? We've had reports. I'm sure it's not limited to the US and those other countries we've heard, even within Nigeria as it is. Someone walks to a hospital to complain about the way he's feeling, and in a few hours he slumps and just dies. In the midst of this second wave, what seems to be happening?
Glad you don't get me into a hook. We're not doing clinical diagnosis here, but I can give you from the scientific background. What I know is that if you haven't, death doesn't just come like a flip of a finger, boom, like this. It's only when you take a poison like cyanide that stop the respiratory activities that you die instantly like that. Somebody who just dies like this, it's not a question of dying like that. That condition and disease has been with him for over some time. People don't manage themselves very well. If you have diabetes can be controlled, and in our own case in integrative medicine, we reverse diabetes, we reverse hypertension. So if you're going there first for the checkup, even if you're looking at the conventional aspect of doing things, if you are being checked and it is being controlled, there is no way you can just drop suddenly and die like that. But even, take for example, some of these organs, the liver and then the kidney, before you hear that somebody has a liver failure or kidney failure, it means that over 75% of the functions or the organs have actually failed before you come to notice any symptoms at all. But if you have been checking regularly, you would have picked that and then taken care of it.
Okay, so this is a reminder on the need for Nigerians to prioritize regular medical checkup.
Very important.
All right, now more than ever.
Now more than ever, yeah. There's just no way you can just drop dead like this unless there is a case of, poison.
Okay, thank you so much, Dr. Toh Abide, for your insights.
It's my pleasure. Remember to come for your immune boosting, protocol with us.
If you're offering me,
no, they said it's not about that. We're here to serve the people.
Thank you so much for coming on the program.
It is my pleasure.
Time now to take you on a trip to the National Institute for Pharmaceutical Research and Development for a peep into local solutions to COVID-19 that are available and at those various stages of trial.
The COVID pandemic brought to the fore a lot of the things we've been talking about as regards medicine security, the need for Nigerians and indeed Africans to look inwards to develop solutions to contextual problems. And so when COVID started ravaging the world, and even before it got to Nigeria, at NIPRID we developed a framework that will enable us contribute very rapidly as regards how the pandemic will be addressed. So one of the first products that we brought to the fore was the NIPRID hand sanitizer. And the interesting thing about our NIPRID hand sanitizer was that in the very first few days of the pandemic hitting the shores of Nigeria, we took the product to the Minister of Health, and after seeing the quality of our product, he directed that we do a national television launch of that particular product. That product has now climbed the ladders to become one of the highest quality hand sanitizers sourced from local materials, and it's a good tool that has been used in disrupting the virus. But in addition to products that can help to disrupt the virus, the other thing that we've also done is a lot of research into products that can help to boost the immune system and definitely help patients with COVID-19 or people who are at risk of getting COVID-19. As you're all aware, the virus has a vicious attack mechanism that inordinately affects people with compromised immune systems. And so our product, Niprimion, is something that boosts the immune system through its immunomodulatory activity, and it has the potential of protecting people from either getting the virus or people who have gotten the virus not to have a very bad reaction. The preclinical tests for Niprimion have all been completed. An international organization has picked up on the good data that has been provided from Niprimion and has agreed to fund part of the clinical trials to see how this will do in the face of COVID-19. Obviously, we have a lot of other products which are also outputs from the Institute. There's the Niprid oil, there's Niprifan ointment, there's the Nipribor capsule, there is the Niprimor that is targeted towards malaria. And there is also this product which we did on contract for one of Nigeria's most powerful individuals. And then the final one is the one that everyone has known NIPRID for, which is our anti-sickling preparation. One interesting thing, NIPRID was one of the first, if not the only agency that has taken a product for sickle cell anemia from drug discovery all the way to phase phase 2 clinical trials. This is that product, and currently we have a licensing agreement with a local manufacturer as regards the marketing of this product. Niprid oil, the active ingredient of the niprid oil is eucalyptus oil. Eucalyptus is an essential oil extracted from the eucalyptus, various varieties of eucalyptus that are available. And the interesting thing about eucalyptus oil is, I'm sure you're aware that certain people, even for COVID-19, have dwelt on engaging on inhalation therapy in order to sort of like help their respiratory system. Yes, to help the integrity of their respiratory system. Well, if you're going to use inhalation therapy and you're looking for an essential oil to use for your inhalation therapy, you cannot go wrong with eucalyptus oil. And I'm sure a lot of people who currently go to get eucalyptus from the market would know that eucalyptus is mostly imported from Europe and Asia. We get our raw materials from Nigeria here, Kaduna, Bauchi, Plateau State all have good eucalyptus, and after getting the raw materials, we have our ultra-modern extraction plant here in the institute where we extract the essential oil, and as you can see, we have world-class packaging for our Niprid oil. Now, as you can see, regardless of the fact that we've worked very hard in 2020 and come out with this array of products, it hasn't been an easy ride. The world over, people know that you cannot class yourself as a world-class country, as a developed country, if you haven't invested in research and development. Across Europe, across Asia, all developed countries invest somewhere between 2 and 5% of their GDP on research and development. Unfortunately, as a country, we're still investing less than 0.4% of our GDP. You cannot make progress except you invest in research and development. Well, recently, especially during the COVID-19 pandemic, we've reached out to the key people, key policymakers in Nigeria, and we've gotten some indication of prioritization and funding for research and development in Niprid. But what we haven't seen is a commensurate engagement by philanthropists, a commensurate engagement from the private sector, a commensurate engagement from development partners. Everybody has a role to play in research and development. All these products, all these world-class products that we've provided are products that will service everybody. In developed countries, you have people who, say for instance, they're very passionate about malaria. They leave $100 million in their will to go to institutes like Niprid to fund research into malaria. Niprid has the best specialty in focusing on diseases that ravage people in the tropical areas, especially tropical diseases that are prevalent in Nigeria. So if you have world-class researchers here in Niprid and you have the funding available and you haven't started funding research and development through Niprid, there's still a gap and we need to look into how we can address that. So the government has done very well by putting its money where its mouth is. As you're aware, the Central Bank of Nigeria recently put forward a multi-billion naira grant aimed at developing phytomedicines and vaccines research. It is quite a step in the right direction as regards the funding of research and development.
And that has been Health Options for this week. Remember, COVID-19 is real and living in denial comes with great consequences. So do not let down your guards. Protect yourself and the people around you. You can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. I remain yours, Rabi Abdullah. Many thanks for watching. Bye for now.